These are anxious times for a lot of people, and one possible way to deal with that is called neurofeedback therapy. I learned more about that in a recent conversation I had with Preston Walker of Walker Therapy Services. Preston, everybody right now is feeling some level of anxiety. How does one person know that he or she is feeling what would be normal during this time?
Right. Well, it really comes down to if it's problematic. You know, there is this situationally appropriate anxiety that many of us are feeling, but when it becomes problematic, that's when we start feeling it physically. That's when we have the tightness in our chest. That's when it starts making it so it's hard to fall asleep. When it starts interfering to that degree, it may be that more is going on than just a situational stress. It may be something that can be treated.
One of the treatments that you specialize in is neurofeedback. Tell us a little bit about what that is.
So neurofeedback is a way to train the brain not to be anxious, or a way to train the brain to be focused. We have this EEG cap that people wear. We'll get measurements of all the different brain waves, all the different sites. We send that into a database and we get statistics of what's outside the norm and what is not outside the norm. Well, this often will correlate with someone's symptoms. So we know with ADD, for example, most people that have ADD have really strong theta waves in the frontal lobe. That's associated with getting lost in thought. So when we observe this, we know, okay, neurofeedback is going to be a good option for them. This is going to help. So if you think about a wave kind of going like this, say they have a theta wave, we're trying to train this down. When it goes down, we give them a reward. So the screen will get bright, music will play. And what happens is this brain wave that starts up here, it adjusts and it gets lower and lower and lower. So they become more and more alert, more and more focused. So this is something that can be used for ADD. This is something that's also used for anxiety, and it's used for depression. So we send them home with a neurofeedback unit, and instead of doing a treatment once a week, which would take about a year, they can go through the process, do this every day, and be done in 2.5 months, in 10 weeks.
And how long will that effect last after 2.5 months of treatment?
Well, that's what's really cool about it, is unlike medication where the effect will wear off really soon, this is long lasting. So they've done 30-year follow-up studies and people's anxiety did not come back.
Walker Therapy Services is located on East Horizon Drive in Henderson. Right now they're offering free consultations as well as 50% off the brain map, and that's for the first 10 callers at 702-530-3740, or you can learn more about it at walkertherapyservices.com. We'll be right back.